Well, spring has officially arrived, and many of us are wanting to head outside, and we look forward to enjoying the spring season. Spring is also a good time to reset with some healthy habits. Christie Leath-Warren with Cone Health Urgent Care from Reidsville is here today with steps that we can take to help stay safe and healthy this spring. So a lot of people, me included, sniffing, congested, my eyes are itchy from allergies. What steps can we take?
So, excuse me. The most important step that everyone needs to take is to understand that allergy medicines are not used on an as-needed basis. So you have to start taking your medication before your symptoms start, and you have to take them consistently. Also, avoiding allergy triggers. If you know you're going to be outside and you know that the pollen affects you, you need to maybe consider lessening that time. Other things that we don't really think about is keeping the windows open or the screens open or our pets going in and out of the home, and even changing the filters on our air conditioning units at home. Those small things can definitely make a change in your allergy symptoms for the year.
All right, so we talk about like steps to help reduce exposure to allergens this time of year. So obviously I get the closing of the windows. Are there other things maybe though that maybe I'm not thinking of?
Well, of course, you want to do your medication. So any kind of antihistamine is helpful. Zyrtec, Claritin, Allegra, some of these you can get over the counter. Some of them may even be prescribed by your primary care doctor. Also, using a steroid nasal spray is helpful, as well as using something as simple as normal saline daily to kind of keep those nasal passages rinsed out. So those things, along with the methods that I just talked about as far as prevention, are very, very helpful and essential.
Okay, and so if the Claritin doesn't work, maybe you try the Allegra, or you give it like a week or so for each one to try?
Well, it kind of depends. It depends on if you have any new symptoms that start with your existing allergy symptoms. Sometimes allergies can turn into something bacterial, like a sinus infection. So if you get a fever or your symptoms worsen after you've taken all of your allergy medications, then at that time it's either time to follow up with your primary care doctor, or you can even visit like a local urgent care for those
Gotcha. Okay.
symptoms.
Let's talk about some common injuries that you see when people decide they're going to do some spring cleaning.
Of course, of course. So, we've been kind of resting all winter long, and now we feel motivated to get up and start doing things that we're probably not used to doing. So, a lot of common injuries that we see are like sprains or strains, overuse injuries, and sometimes if you're outside doing yard work, cuts or lacerations. So, the biggest thing that people need to realize if you're going from a sedentary, day and you want to get out and start doing yard work, you may have to do something simple like a light stretch or a light walk before you even get started, just to help prevent risk of injury.
Gotcha. Okay. So warm up maybe before you start cleaning out the garage. Okay. All right.
Exactly. You would think that.
Gotcha. All right. If it's too late and you've already pulled something, do you have any like recommendations for treating those aches and pains?
Yes. So at home, if you do something simple like rice therapy, I know all of us have heard that at one point. Rest, ice, compression, elevation, those are the things that we would start with. You may need to take an anti-inflammatory like ibuprofen or Motrin, as long as it's not contraindicated. Those are the initial things that will be recommended at home. But if you're doing these things and you're just not getting any better, at that time you would need to consider seeing a doctor at that point.
Okay. And as people jump back into their outdoor routines like runs or bike rides after a slower pace with winter, what's your advice for preventing the injuries from doing maybe too many things too fast?
That was going to be my first recommendation. Don't do too much too fast. And going back to, going from a sedentary day to doing something strenuous, like simple as walking, even, you want to make sure that you're stretching even before and after the activities. Of course, you also, like I said, a nice warm up. So you don't want to just start doing something really strenuous. So you want to give yourself time to build up to it. And usually you want to increase your level of activity approximately about 10% on a weekly basis, just so you don't have any injuries long term.
10%. So don't go from 15% to 90%.
Exactly, exactly.
Okay. All right. So minor injuries happen, the twisted ankles, the cuts, the mild rashes. What can safely be treated at home, and what are maybe some like red flags that says, nope, you got to go see the doctor?
So at home, if you have like a small cut or a mild rash or even a minor sprain, you could treat that at home. Again, with some of the things that I mentioned previously, like your over-the-counter ibuprofen or Tylenol or a topical antihistamine cream like Benadryl. If those things don't work, your next step, you could do a virtual urgent care visit, which we do offer at Cone. And those things are good sometimes if you're kind of unsure as to, am I getting better? Do I need to see someone? Or is this something that can still be treated, virtually? So things like that may be like a skin condition that is just not getting any better, or even a bug bite. Those kinds of things would be appropriate for a virtual visit. And then, of course, there's an in person visit in urgent care. So, if you have a moderate sprain, or if you have a bug bite that's not getting any better, or if you have symptoms that are just not improving at that time, it may be necessary to see someone in person. And then, of course, there's the emergency room. You definitely want to go to the emergency room if you have a deformity of a bone, bleeding that you can't control, trouble breathing, or a fever.
Okay. All right. We're going to continue the springtime injuries and good health habits coming up in the next few minutes. We hope you'll stick around.